Thank you very much, Carlos, for your kind introduction. And I will speak about the relationship between DAO and ADHD. Well, first of all, I would like to make the point on the relevance of ADHD as a diagnosis. We are speaking about a disease which is very prevalent worldwide. We are speaking about between 4 and 8% of the childs and adolescents worldwide are diagnosed with ADHD, and half of them will be diagnosed with an adult ADHD. So basically, we're speaking about nearly 3% of worldwide population as an adult who have this diagnosis. And another thing which is also very important has to do with the ratio male-female, which is approximately 3:1. And we are speaking about a disease which is basically genetic, although there are some issues during pregnancy and during the first years that are also important. Also, I would like to make the point on the treatment, multimodal treatment, which is based on stimulants and non-stimulants medication, psychoeducation, psychotherapy, and I will say also sports. It is also very important for me to clearly state that we are speaking about a disease that increases mortality between 2 to 8 times. And this is, let's say, it can happen in childhood, also adolescence, and also in adulthood. Also, it's important to stress that this mortality risk is even higher in females because usually ADHD is more difficult to be diagnosed correctly, and obviously the treatment is not applied if there's no diagnosis in females. Also, this is very important. This is a very huge epidemiological record with about 10 million people in Sweden. And in this very beautiful paper, the authors demonstrated how you can see here that male ADHD, usually the partner has autism spectrum disorder. Females usually with ADHD have partners with ADHD, and people with autism disorder usually have also a partner with these diseases. So we are speaking about a disease in which the people who are affected try to get with a partner with the same diagnosis. So that means that the genetic background usually is going to be higher in the children. The second point that I would like to stress in this conference is that more and more researchers begin to see ADHD as not just as a brain disorder or a mental disorder, but as a systemic disease. And this is why. Because ADHD is not only has a very huge comorbidity with other mental disorders, but also with other systemic diseases. I would say that probably they have about 3-4 times more probability to have bones fractures or atopic diseases, etc. So this is a very recent publication, and you can see here that people affected with ADHD usually have more vascular diseases, such as Kawasaki disease, or let's say more dermatological issues, such as psoriasis, atopia, and also more migraine and sleep disorders. Well, this is critical. ADHD people usually have very poor sleep patterns. So if we see what is happening with histamine intolerance, just a simple search in the PubMed, we see that there's an increasing interest on this molecule, but there's very few literature on the role of histamine in the brain and in the behavior of people. So I also would like to stress that when we are speaking about histaminic intolerance, we are not speaking only about genetics, because you can have let's say the SNPs associated with this intolerance, but there are a lot of medications very usually used that they are also associated with less functioning of this enzyme. Let's say that we might speak about phenotypes that that people who have this the genetic okay, but that the enzyme is not functioning because of the medication that we are using in these patients. So in this paper, the authors let's say that they told us which are the most relevant symptoms, and we can say that they usually have to do with the gastrointestinal tract, but also with the skin and also with the respiratory and cardiovascular system. I would say that one of the most evidence on the polymorphisms of this enzyme and a clinical result is migraine. I think that the literature on this relationship is clearly higher than in other relationships. So I would like to focus right now on the role of histamine in the brain. So there is very little literature on this, but we begin to see some studies regarding the role of histamine. And this is important because, for instance, there is literature about when using methylphenidate or atomoxetine, which are two of the more prevalent medications for ADHD, there are studies pointing at the increase of histamine in the brain of people with this using these treatments. Okay. Well, another area of interest is that there is increasing studies focusing on the H3 receptor. Usually, because they are thinking about using this type of medications on Alzheimer, but it might have also a role on ADHD. So this has to do, well, there is increasing evidence about, let's say, the neuroinflammatory hypothesis on not only on ADHD, but also on depression. And this work is to point about that even doing sometimes of psychotherapy, we might change the let's say the concentration of histamine in the brain. Well, we could say that the same way that we can speak about the missing link between depression and neuroinflammation, we might say that probably there is a link between ADHD and allergies, and probably a dysregulation of inflammatory processes. So this is a paper that we are elaborating. This is just the data about 89 patients, but we are finishing the recruitment of this study. Currently, we have 282 patients, but we don't have all the data in the database. So we are processing, and all this data right now are about the first 89 patients that we included in this study. I would like to say that the first thing which is important is that all these patients are diagnosed with ADHD, and about 80% of them, they have at least one of the 4 variants that we are studying, which is not working well, performing well. So 80%. So the first question when we began this study was, wow, this is very frequent. The question that rises in our minds was, well, what happened in the let's say, in the general population. And the thing that I know that there are some of our colleagues that they are going to speak about this. There are ongoing studies about the prevalence on this deficiency in the general population, because right now we have no this data to compare. But we can say that these deficiencies appear to be very, very frequent. I can say you that of the 282 patients, probably, we have data of genetic data of about 220, this 80% continues to be. So it's 80% of people with ADHD have at least one of these DAO SNPs alterations. Also, it is important that 20%, about 20% of our population has very, very severe deficiency of this enzyme. So we are speaking about 1 out of 5 patients. So in the preliminary analysis, we have found some interesting findings. The problem is that some of these findings, we have no literature to compare. For instance, we have found that both 2 of these SNP variants appear to be related with antecedents of kidney problems. And in the literature, we have found that this variant 1, is associated not with kidney, but yes, with some hypersensitivity to non-steroidal anti-inflammatory drugs. And we all know that this type of drugs can play a role on kidney problems. So we suggest that probably this variant may have a role on this. But as I told you, there is barely just one article to compare our results. We also have found some relationship with atopy, also with the use of glasses, and also a protective effect on epilepsy. It seems that the people who have this deficiency will have less prevalence of epilepsy. I will speak also about putative positive effects of this deficit, because somewhat we didn't expect this, but we have found that children with 3 or 4, I will tell about this later, 3 or 4 of these deficiencies have a higher IQ. But another finding which is interesting is here. You can say that people with 3 or 4 of these SNPs alterations, they have more risk of having comorbid binge eating disorder. And as I was telling you, the IQ was clearly higher in people with 3 or 4 variants. So probably there is something that has to do with the availability of histamine in the brain that produce, let's say, a positive results. And it is also interesting to see that if you see in the working memory, people with non-severe DAO reductions have better working memory than the people with severe DAO reduction. So it seems that in some way, having 3 or 4 reduced SNPs for DAO activity is related with higher intelligence, but with whenever there is a very severe DAO reduction, intelligence, working memory is worse. Also, there is a relationship with verbal comprehension, and it seems that people with 3 or 4 of these variants, they have better verbal abilities. And well, this is the last slide, and it has to do with the most important take-home message that has to do that the paradigm of ADHD is changing. There is more and more people studying the relationship of ADHD on different medical diseases. And if we see which are the medical diseases that are usually associated with ADHD, we are speaking about nervous system, we might be speaking about migraine, respiratory, we might be speaking about asthma, which is clearly related with ADHD. Let's say musculoskeletal, we could be speaking about fibromyalgia, endocrine or metabolic, genitourinary To sum up, some of my colleagues who are speaking right now are speaking about all these medical diseases that they are usually associated with ADHD. That's all. Thank you very much.